think employers they're in a difficult position when it comes to designing their health plan using incentives. It's really challenging to have different types of, let's say, cost sharing for different types of healthcare services. I think ideally they would like to do that, figure out a way to incentivize the high valued services and de-incentivize low valued services. And to some degree, we've seen a little bit of that, especially with the incentivizing high valued services. I think perhaps one of the best examples lately has been related to HSA plans. One of the criticisms when the HSA law was passed 20 years ago was that most preventive services could be covered outside of the deductible, things like cancer screenings, but it was a very narrow definition on what could be excluded from the deductibles. And after years of kicking and screaming, the IRS in the summer of 2019 came out and said, look, we're going to allow these 14 services to be covered outside deductibles, things like insulin for people with diabetes. And we saw a pretty strong response from employers very quickly to move, at least one of those 14 services. Not every employer did all 14 services, but within 2 years of the IRS releasing that notice, 3/4 of employers had at least added one of those 14 services, or at least allowed coverage outside deductibles for at least one of those 14 services. The interesting thing to me is that years ago, we tried to do a study looking at what's the best cost sharing above deductibles to manage use of healthcare services. Is it coinsurance or is it copays? And we found next to nobody with copayments above deductibles. So we couldn't even do the study. It was something like maybe 1% of our sample. So it wasn't worth doing. But the interesting thing is a lot of the employers that added or took these 14 services out of deductibles added copayments for those services instead of coinsurance, which is, to me, that's very interesting because you've got copayments, a deductible, coinsurance, 3 different types of cost sharing within a health plan. I think employers would like to figure out a way to incentivize the use of high valued providers, whether, steer people to, certain hospitals or certain doctors or certain types of outpatient services. I don't think they've got it quite right yet. I've seen examples where they've done that based upon more so on cost and quality. But, this is something employers would like to do. And I wouldn't be surprised if we start to see more and more of it, just as the data develops and the technology develops to analyze that data. And to, the problem is you're potentially creating a very, I like to call it a sophisticated plan design, but it, for the average user, it's a very complicated plan design. I think you need to separate out. You could look at deductibles and then you could look at the accounts, because there are a lot of people in plans with high deductibles that don't have an account, right? And you could argue that it's the deductible that changes the way people use healthcare services, perhaps more so or at least differently than the account does when it's attached to the deductible, right? We know what deductibles do. When people move from low deductible plans to high deductible plans, use of healthcare services do fall. It does look like it's a one-time hit, right? Because the high users of healthcare, we typically quote the 80-20 rule, right? The 20% of the population that use 80% of the healthcare, they're going to hit their deductible every year, right? And an even smaller percentage, 10%, account for 70%, almost as much healthcare. They're going to hit their deductible every year. And chances are, maybe the first year they're going to change the way they use healthcare, but they're going to figure out they're going to hit their deductible regardless. So it really becomes the price that they face at the end of the year is going to drive their behavior at the beginning of the year more so than the deductible, right? So, and that's why oftentimes you see as employers move to high deductibles, it's only a one-time savings. And you got to figure out how to manage the people that use the most healthcare. The account is interesting because the question is, does the account create a savings mentality or a spending mentality? Right? Especially if your employer is putting money in your HSA, right? Do you view that as sort of first dollar coverage? And a lot of employers put money in people's HSA for that purpose, so that to minimize the effect of the deductible. And we have found, this is a study from almost 5 years ago, so I'm trying to remember exactly what we found. That I think once you reach a certain account balance, it may start to change your behavior. People with larger balances start to use more healthcare services. And that certainly makes sense, right? Because if you think about it, once you have enough money in your account to cover your deductible, then essentially you might view that as first dollar coverage. And very few people max out their contributions. So they're not really using it as a savings vehicle, or at least most people aren't able to use it as a savings vehicle in the sense that they're putting in as much money as allowed to. And most people aren't investing the money. Right? So most people view these accounts more as a spending account to cover, today's healthcare services rather than a savings account. Even though, going back to that 80-20 rule, 80% of the population should really be thinking about these accounts as savings accounts, because in any given year, they're not going to use a whole lot of healthcare. And I guess one more thing to keep in mind is we just released a study on related to this IRS notice and medication adherence. Right, we wanted to see what happens. Like I said, we know what happens when deductibles go up. People use less healthcare services. So we wanted to put the opposite to the test. When you take certain medications out of deductibles, does the use of those medications go up? And we did see an increase. It wasn't a large increase, but the interesting thing is when we looked at this like 10 years ago, when we were looking at a population that moved from a low deductible plan to a high deductible plan, use of certain medications fell, but it didn't fall that much, right? So we wouldn't expect the increase today to be that high, because it wasn't that much higher to go. It's not like we're not seeing a reduction from 90% of the population with diabetes being medically adherent to their medications down to 20%. It's more like, I think it was about a 10 percentage point drop. So probably went from, I'm making this up, from about 90 to 80. And now maybe it's come back a little bit from that.